So the way I think about these conditions are really difficult symptoms with no normal tests and no serious medical cause. The symptoms vary between young people, and no child or young person is the same as any other young child. So you will find through the series of these videos that not everything I'm going to say will refer to you or your child specifically, but I hope you will be able to pick up on definites which do apply to your child or to you yourself. The first thing to understand about this is what causes it, what sets it off and what starts it in the first place. I think that generally it starts off with some kind of inflammatory process within the gut. Most commonly that's a tummy infection. So the tummy infection happens because children get tummy infections all the time, and most children shake those off. If I do endoscopy as part of my job. If I were to put a camera down inside somebody's gut when they have an infection, it's very, very sore and red and raw on the inside, but the gut's very quick at healing itself. But for some unfortunate young people, after the gut is healed, the lining is healed, it leaves the nerves very, very hypersensitive afterwards, and it leaves the gut in a state of hypersensitivity and being poor at regulating itself. What I often say to my patients is there's a condition called shingles, which is where you get chicken pox sort of in almost a stripe on the skin, and it's excruciatingly painful. It happens to older people. But actually when that heals, often the skin is just as tender afterwards for quite a long period of time. And you can look at it, it looks completely normal. I could biopsy it, it was completely normal. Blood tests would be completely normal, but it's really, really tender. And it's because of that nerve hypersensitivity. And that's what's going on inside your bowel, which is what's causing these really unpleasant symptoms. And what you need to understand, and I think part of getting better is understanding your condition better, is that because it's not a serious medical problem, actually there are no easy medical treatments to get rid of the symptoms that you're having. So, what I say often is that there'll be no magic wand. Don't think that there's going to be a medicine that somebody's going to give you and you're suddenly going to get better. But saying that, there are lots and lots of things we can do which will just gradually improve the situation, probably over weeks and months. And for some people, they always have to accept they've got a degree of sensitivity within their tummy. So what we're going to look at is what we can do to help the situation, recognising there's going to be no quick fix. There's no doubt that the first part of getting better is understanding the condition you have. Understanding that there is no serious medical cause, understanding that it's not that the doctors have missed something and that there's some tests that you could have and some medicine you're going to have that's suddenly going to get you better. It's understanding that the doctors can make this diagnosis of these conditions very clearly. There's no test to prove it, but an experienced doctor talking to you, looking at the symptoms, examining you, can make a very clear diagnosis of this condition. So if you've been directed towards this video, already the doctors are clear that's what the problem is. And part of you getting better is accepting that, but it's also understanding the condition and understanding what's causing it, and then you're not so frightened by the symptoms when they happen. Other things that tend to kick in, which I always think of making a bad situation worse, is if you worry and focus on your symptoms a lot, which of course people do, that just accentuates them further. There's no doubt that as these horrible symptoms continue, it changes your life and it changes your family's life. So you stop doing the things that you used to do as a family, you stop doing the things you do with your friends, often going to school is difficult. And of course, the more that you withdraw into not doing those things, you focus more on the symptoms, but also it affects your mood. Everybody's low in that kind of situation. It can add to anxiety, and these things also make these sensations much worse from the gut and the symptoms worse from the gut. So part of what we're going to be trying to help you with through this series of videos is understanding those links. The other thing to mention is sleep. There's no doubt that young people with these kind of symptoms, night times are particularly difficult. So at night times, young people tend to focus on the symptoms. It's very difficult to get to sleep. They get into a very bad, or frequently into a very bad sleep-wake pattern, where they're lying awake at night time for long periods of time, and then either very tired in the morning or struggling to get up to school in the morning. And all of us know that if we're tired, we tend to be a bit more hypersensitive in lots of ways, and that again just makes a bad situation worse. So I'm going to finish this first video here. I hope by the end of this you understand that the doctors made a very definite diagnosis and they don't need to do any more tests. They're not telling you you've got this condition because they don't believe you. We absolutely believe you. It's just there's no serious medical cause and it's not an easy thing to fix. And what we're going to do through a series of videos is help you understand the condition better and try and look at things or coping strategies and things that you and your family are doing probably which overall are probably making a bad situation worse, and we then need to try and get you back to doing things normally. But I suppose the only final thing to say is that we've looked after hundreds and hundreds of young people with these conditions, and we know that we can make young people very much better. We can't always take the symptoms away completely, but we can help you get back to doing all the things you would normally be doing at your age.